Okay, Akhil, do you think we should start?
Maybe we can even just start. I think we can do little introductions as well. I think most of the people here we know, so I think we don't need to introduce HiMed necessarily, but maybe everyone can just do a quick hello.
Sounds good. Someone is okay. No taker. So I can super quickly start. I'm logged through HiMed's account, but my name is Marie, and I'm currently working as the executive director of HiMed Medicine, which is a non-profit organization dedicated to inspire all of you guys to do a lot of good with your careers and donations. And I would love to actually. I'm already recording this event, but if any one of you feels uncomfortable with this, recording being shared, please reach out. Maybe we can afterwards publish the speaker part, like the talk only, without the Q&A section. And yeah, always feel free to reach out if you disagree, and otherwise I will just go forward and publish only the talk section. Yes, and I will forward to Vaishnavi.
Hi everyone. It'd be nice to see a few human faces. If you can turn on your cameras. Excited for this talk. Are we supposed to do like an intro? Okay, I'm based in Singapore. It's 10 p.m. No, 9 p.m. And yeah, this is quite important, close to our hearts, especially with everything going on. So thank you, Akhil, for taking the time to do this. Yeah. Maybe I'll pass it to Vijani.
Yeah, hi everyone. My name is Kujani. I'm the podcast host for High Impact Medicine and also do a bit of promoting high med in Cambridge. I'm really looking forward to this talk. We recently had some training during our introductory course, so really looking forward to enriching what I've learned then.
Maybe Himanshu, do you want to go next?
Sure. So I'm Himanshu. I'm from India. I study computer science. I have not been involved with high-tech medicine at all, but I'm part of the EA community mostly, and from there I heard about I read Akhil's articles, and they seemed very something I care about, and that's how I'm here. And great articles. Thanks for the great work.
Thank you so much. Do you want to pass it on to someone else?
Oh yeah. So Alex, I guess.
Yeah, can you hear me?
Yes, we can.
Yeah, sorry, my Wi-Fi is kind of spotty. I'm on the way to the office right now. I'm Alex. I'm a psychology and public policy PhD student at Princeton, and I do research on preventing violence against women, mainly through large-scale field experiments. So yeah, I've read a lot of your stuff, Akhil, and it's been super helpful in my own research and hoping to learn more.
Yeah, fantastic. I think, Ulrike's just said her mic and camera don't work. So I'll just read her introduction for her. She's a medical doctor from Germany doing a master's in global health right now. And I think Marie mentioned that she's in the middle of the career fellowship at the moment, which is great. And Dieter, I know you're on the road at the moment, so don't worry at all if you can't unmute yourself. Be safe on the road first, but I'll give you a second to unmute yourself if you can. Cool. No worries. And also hello to Sharon's note taker. It's a pleasure to see you. I don't think Sharon herself is here. So look, it's a nice small group of us. So we'll keep it kind of light. So my name is Akhil. I'm a physician. I'm based in London at the Royal Free Hospital. I'm an internal medicine doctor, and I also kind of do some global health research and grant making work. I thought what could be quite interesting, relevant to some, maybe not as much others, is rather than just presenting this as this is the cause area and these are the interventions, I will be doing that, but I want to go chronologically through how I got interested in this area how my work has evolved in it and how my grant making has kind of arisen. Because I also think that might be useful for people thinking about an area that they want to invest in or look into, and what that process looks like, and some of the things I've learned along the way. So I thought that might be a nice way to structure it, rather than a kind of didactic presentation on violence against women and girls entirely. So I've been working as a doctor since the start of 2021. I graduated in 2020. While I was working, while I was a med student, also working as a junior doctor, I worked in an area off Sydney in Australia where we were in a part of the city where it was a fairly rough part. And so we would see at our emergency department a lot of women and girls come in who had been victims of violence. And this was always something that had stuck with me, but I hadn't really known what to do about it. I had done some training courses on gender informed care as an A&E doctor when I was an F1, but beyond that I thought, that's kind of, it's an awful thing to see so much and so frequently. And then in 2022, I started working at charity entrepreneurship. I got more involved in effective altruism and worked as the global health researcher at charity entrepreneurship. And through that, I learned a lot of the tools of how we can prioritize cause areas. So I'm sure it's familiar to everyone here, but the kind of tractability, neglectedness, scale kind of framework that I'd seen. And through that job, I'd also learned kind of how to assess cause areas and interventions through those frameworks and other kind of frameworks that I'm sure we've all seen, and I wrote about when I wrote about this area. At the end of 2022, Open Philanthropy put out a cause exploration prize, and they were basically looking for new potential areas that they could start as a program in their global health kind of domain. And so they invited people to present potential cause areas. And I remember there was a good amount of prize money attached. So I was sitting at home with my partner and kind of thinking like, oh, what potential cause areas could we look into? And she's also a physician, and she had worked in the same hospital as me. And we'd spoken a bunch about how much we had seen victims of domestic violence present in our A&E. And she's always been quite critical of effective altruism on the basis that there are a lot of interventions and cause areas that are not as simple as vaccines and malarial bed nets. At the end of the day, doing a cost-effective analysis of a vaccine or a bed net is very simple. For a vaccine, you know what the incidence of a disease is before, you know what the mortality rate is, and you know with a vaccine how effective it is, right? And those are basically the only parameters that you need to do the cost effectiveness analysis. And even though the GiveOn models look very complicated, they are relatively simple for a quick or a simple one-step intervention like that. But something more complicated and more systemic and more foundational, maybe in a more social intervention like violence against women and girls, she always felt like this is something that might be systematically missed by a movement that looks for quantifiable interventions. And so I kind of thought, okay, well, let's put our EA hat on and let's see how this cause area looks from the perspective of EA. And I know that it's going to be difficult to quantify a lot of these things because the effects of violence on women are profound. There's physical, there's health, there's mental health, there's social, there's family, and there's short and long-term consequences of all of those things. But let's just have a look at the area. And so I spent actually not a lot of time doing the research, and I'll get into how kind of I approached the research and things like that. But I thought, okay, let's have a look into this area. And I used that kind of scale, tractability, neglectedness framework. And, I didn't have a strong sense before I started this of what I was going to find. I also was not an expert in this area. So my level of knowledge beforehand was, I'm a physician, I have seen violence against women and girls on the front line, and I have some research skills through my job. And so kind of going through what I found. I think some of you have read it, but I can kind of highlight some of the takeaways. So, 1 in 3 women will be victims of either sexual or physical violence at some point in their lives, and between 10 and 15% will be have been victims of violence within the last year, which is an incredibly high amount. And the global burden of disease, which is kind of the authority on kind of telling us what the burden or the health burden of any particular condition is, estimates that it's responsible for 8.5 million disability adjusted life years and about 70,000 deaths. It's important to bear in mind that 8.5 million DALYs is definitely an underestimation, because the only things that they look at there were physical, like femicide as a result of violence, or actual physical injuries and what they resulted in, and higher rates of depression and anxiety. They don't capture any other of the impacts that violence may have on women. And so that is in and of itself I understand, because the global burden of disease is a very large, reputable source. They have to have quite high evidence to claim that any particular disease or condition causes health impact. But it's important to bear in mind that that is a very narrow, probably limited conception of what the DALY burden or the health impact of violence is going to be on women. It doesn't account for any of the economic, long-term effects, cultural effects, any of those kind of things. But even then, from those metrics, you can tell it's a huge issue. And for young women in particular, women between the ages of 25 and 29, it was a top 3 to 5 killer of women in a lot of countries. And I mean, I've kind of mentioned this, but we can all kind of think about, or might know, what the effects of violence would be for a woman in the short and long term. And so part of my work was trying to map what that specifically was. So I mean, I kind of thought about it in terms of a few different areas. I thought about the physical effects of violence. So women are physically, obviously, have acute physical injuries, and there's also, that includes femicide. There's sexual and reproductive health implications, so unintended or unwanted pregnancies, pelvic infections, STIs, unsafe abortions, fistulas. There's mental health effects, depression, anxiety, self-harm. We know that these things are more likely for women who have been victims of violence. And then also there's behavioral implications in the short and long term. It's associated with higher rates of alcohol and substance abuse. It's associated with lower rates of contraceptive and condom use, probably because of fear or difficulty in accessing some of those services. So that portrayed a very clear scale of this issue, and that wasn't even touching on the economic implications. So we know that when women are victims of violence, for an individual woman, it means she will probably, if she's working, she will be taking time off work because of the physical and mental health implications, but also it decreases workforce participation. If you live in a society where, let's say, for example, in parts of India, there've been some studies for women who are not in the workforce, to what extent fear of violence or sexual harassment disincentivizes them or stops them from entering the workforce in the first place. These numbers are not trivial, right? And so it was even hard to capture the economic effects. So I only looked at the amount of days taken off work due to being a victim of violence, which is very simplistic, because on a broader cultural level, we might just have lower workforce participation of women because it is not safe for them to work. But this was kind of some of the work on mapping the scale of the issue. The next thing to assess was, is this a neglected problem or not? And whilst there is a lot of attention to violence against women and girls, and whilst it's culturally known that it's a big issue, actually there isn't that much philanthropic or other funding or government funding that goes to it as an area. There are some domestic programs that are run, but I was really surprised with how little funding flows into the area. There's very, very little. So it was very even though it's a well-known issue and an issue that a lot of people care about, which I'll get onto more later, it wasn't one that was receiving a significant amount of actual funding. People weren't actually investing in the area. The third and trickiest question, and I think where I was least confident that we would find something that looked very good from that EA mindset, was tractability. So are there actually solutions here that can make a big difference? And I used a medical framework here that I actually really like using for all health interventions, which is like primary, secondary, and tertiary prevention. So primary intervention is stopping something before it happens. So that's, I'll take an analogy to another area. So that would be something like assault or a sugar tax to prevent obesity or hypertension. Then you have secondary prevention, which is early detection and intervention. So that would be screening of folk who are at risk of hypertension, screening folk who are pre-diabetic and making sure that we treat them early. So early detection and intervention. And then tertiary prevention, which is treatment of a condition that already exists. So someone already has diabetes or hypertension, and we're now treating them with appropriate pharmacological and non-pharmacological therapies. So the way that looks for violence is primary prevention is stopping violence before it happens, secondary is early detection and intervention, and tertiary is treatment of violence after it has already occurred. And so I split the way I thought about the interventions into these three boxes and looked at, okay, what are all the interventions out there and how effective are they? And where is the relative focus? And look, I think understandably, of the limited funding that was in the area, a lot was on tertiary prevention, so treatment of violence that has already occurred. And I want to make it clear that I think that all work in this area is very valuable. But what we found when we looked at tertiary prevention was the things that would fall into this category are things like safe houses and protections for women, treatment of their injuries, providing contraceptive and other health advice after violence has occurred. Unfortunately, for survivors of IPV was at a time when a lot of the damage had already been done, and there were, depending on where we are in the world, for most places, actually, this was where most of the money was going to. And so whilst there is a lot of work to be done for expanding services for victims of IPV, it didn't look incredibly cost effective and was probably the least neglected. Secondary prevention, like screening and referral of at-risk women, was an area that I was really interested in, but there was really low quality data available. So I think that that's an area that could be quite promising, but there was just not much available. So, we know that there are some populations who are more likely to be victims of violence, so women who marry early, women who work as sex workers or in other professions that are high risk. We know that there are at-risk populations. And so I think logically it would follow that there would be some interventions that would be good for at-risk populations, but there wasn't much data. Then we looked at primary prevention, preventing violence before it happens. And to me, I was least sure what was going to work here, because obviously the drivers of violence they're quite foundational. They're related to culture and gender norms, and those things are traditionally not easy to shift. But there's actually incredibly robust data for primary prevention in violence against women and girls. So taking a step back, between 2014 and 2020, the UK government ran this incredible program from their foreign aid, from the FCDO, called What Works, where they invested about $35 million into randomized control trials and other high quality studies that were trying to figure out what works to prevent violence against women and girls. So there were 6 or 7 RCTs, really well-powered studies looking at social interventions, culture and gender norm changing interventions around primary prevention. And so unlike what we might have expected in a social intervention like this, we actually had really good, high-quality data on primary prevention. And there were a few different types of programs for primary intervention that existed. The first, and the one that existed for a while before, is self-defense training. So there's self-defense training for adolescents, and it's self-defense training and also like de-escalation training. So it's self-defense, both physical and non-physical. There's a well-known charity. There is a well-known charity because No Means No worldwide that works in school doing physical and non-physical self-defense training for adolescent girls. And actually that looked okay. It's but not super cost-effective. And then there was actually a new wave of intervention that came from What Works, called what we call these kind of community-based activism interventions, and they're quite difficult to conceptually wrap your head around. I was lucky enough to go and see them, but basically the way it works is you get a group of volunteers, and they work within a community, and they work longitudinally, so over a long period of time, over 24 to 48 months, and they work on shifting culture and gender norms at an individual level, at an interpersonal level, so working with couples, at a local community level. They work with religious community leaders, schools, faith leaders. They work on a local government level with police, with local government to, make sure that it's understood as an issue. And so they try and drive this gender and culture change from all these different levels. And there are packages of like how to do this intervention. So these volunteers aren't just going out and figuring it out by themselves. There are organizations that have created toolkits on how they can do this kind of community activism based intervention. And actually, incredible data, what they found was that after a couple of years, there was reductions of between 25 and 40% in violence, and higher reductions in attitudes towards violence in these communities. And those effects persisted over time. So there's follow-up studies from 3 and 5 years that show that these effects seem to persist. And conceptually, and even talking with funders, which I'll get into more later, this was a really tricky thing for them to understand. Like, how can you just talk to people and change their attitudes? But when you have locally embedded, community-led initiatives over time that are working on many different levels, it's not difficult to see. And when you see these people working in the community, activating the community to care about this issue, it can make a profound difference. And so this intervention looked really promising. And when we did the cost effectiveness modeling on this, with the caveat that we could only capture a very small amount of the benefits. So the health and the economic benefits, we only captured a very small percentage of those. It looked like the DALY burden was between, $20 and $100 per DALY. So well within the give well range, or perhaps even stronger. And that's beyond thinking about any of the benefits of social equity, gender rights and equality, like all those kind of intangible values of living in a more fair and equitable society for all people. We're not capturing any of those benefits. We're not even capturing all the health and economic benefits. And so when I was talking to Open Phil and talking to funders, I was like, look, this is the modeled cost effectiveness. You have to add on to that whatever you think the social or cultural value of this is beyond those things that we can't model. And so it looked like an incredibly cost-effective intervention. I'll pause there. I'll just quickly answer Vaishnavi's question. Not much government is specific to a country globally. Globally, there is not much money on it. It's particularly neglected in low middle income countries, but even high income countries, there's not that much. There's barely any money. It's mostly for that tertiary prevention, so quite neglected on a global scale. So I did this work for Open Phil. I wrote that report, and they were interested in the cause area. So I then, over the course of January, February, March 2023, they asked me to produce some more work on the area. So they commissioned me to do some more work. And so I dug into my models. I made them more robust. I looked into the interventions more. I looked into charities doing those work and talked to, a dozen, 2 dozen charities working in the area, understood what they were doing, and came back to Open Phil, I think in March of April of 2023, and said, hey, like, this is I've updated our cost effectiveness models. Of course, when you add lots of complexity, it still looked quite cost effective. I think my revised estimates are around $100, $120 per DALY. And I found, after a lot of searching, 2 or 3 charities that were doing this cost effective intervention in a cost effective way. The things that I want to mention here are, there was a bias here. We were looking for charities that were large enough to have at least 100K of funding, so we would have missed some small charities. We also may have missed charities that don't have any of their communications in English. I talked to lots of experts to try and understand who worked in the target areas that we were looking at, to see if we had missed any charities, there was any on their radar. So we tried to be as systematic and robust as we could, but there is, of course, those biases in the charities that we identified. But I took that to Open Phil, and unfortunately, this was when crypto was crashing and the financial stocks were crashing. And so their original hypothesis was that they might start a cause area in this area. And they very transparently said to me, look, if we were expanding our funding on global health, we probably would start a cause area in this area, but we're actually contracting our funding in this area. So we're very sorry, but like we can't make any grants in this area. They were very upfront, and the situation changed in a way they couldn't have predicted. But through this work, I'd kind of been figuring it out as I'd gone along with the research, talking with charities, doing that evaluation, and I ended up doing quite a lot of work. Again, I wasn't an expert in the area, and I think it's really important whenever you're doing work to make sure it's really clear. As doctors, we're always told the first thing when you're doing a handover is, who are you? My name is Akhil. I'm the medicine trainee. And you're always meant to introduce yourself and your position. And so, it's really, I'd never claimed to be an expert in this area, but I had amassed some knowledge of it. And I didn't want it to sit idle. At the same time, I was starting to get different individuals and organizations approach me based on some of the work I'd written and ask for advice on where they should be giving money. And that ranged from, I had a colleague who I peripherally knew, and his mum was thinking of giving $2,000 or $3,000 to Violence Against Women and Girls charity. And so I had a call with her and we chatted through it and we talked about where she could give her money. And then I also had a high net worth individual who wanted to give $500,000. And we had a 1-hour conversation and they gave money to 2 of the charities that I suggested. But over the course of the next 5-6 months, I ended up just kind of ad hoc doing these kind of calls with people, and I was doing a lot of them. And I wasn't really doing any active outreach, kind of through word of mouth, because I think this is an area that we all understand. I think we all, regardless, have some personal connection or deep understanding of what violence feels like and how disempowering it is for women. It's an area that people naturally care about and feel like they want to contribute to. And so there was a lot of people reaching out to me, I hadn't actively done it, who wanted to give to this area. And just on a meta point, I think, when you're thinking about an area that you might want to work on, of course, then in terms of scale, tractability, and these use framework, but also something that I hadn't realized before, do people care about this issue? So, I've done grant making on other areas as well, where there's 2 challenges. One is to convince people to care about it, and secondly, to convince them to give to things that are effective. For violence against women and girls, people already care about it, and they want to be giving to these charities. And so that first bucket of work is already done. And so motivating people to give, they don't need that motivation. I didn't realize that was a really important thing when considering an area, if you want to work on philanthropy or in grant making, to think about, do people care about this issue beforehand? Or is this an issue that I think I can make people care about? But so I was doing this kind of ad hoc work, and I realized, I was having a lot of similar conversations, which was by no means an issue. If I can have a 1-hour call with someone and they gave even $200, I mean, that's a great outcome. But at the end of the day, maybe I wasn't able to reach everyone, and I was relying on word of mouth, which was not reliable. And so I mentioned this issue to a friend, and she said, you should talk to this charity called The Life You Can Save. And they have philanthropic funds in different areas, similar to Open Phil and Give Well and Giving What We Can. And they have one on women and girls. Maybe they'd be interested in this. And so she connected me with their research team, and they were really interested in revising their entire women and girls fund. And basically for them, it was a really attractive proposition. I was like, hey, I'll do the work for you. You don't have to pay me. I'll revise your fund for you. I've done a lot of this work already. Whatever additional work, tell me what your researchers would have otherwise done, and I'll just do it. And so I did. Between kind of May and October, in my spare time, I basically was like an employee. I wrote their reports. I talked to their internal comms team. We went through all the processes of adding 3 charities to their Help Women and Girls Fund, and also revising some of the other charities that already existed in there. And last year, around November, for the International Day/Week for Preventing Violence Against Women and Girls, we launched the fund. And so now people who want to give to the area can easily give through that fund. And that's a really sound way for that to happen. In terms of what I currently still do for that work, for violence against women and girls, so I am a research advisor for that fund. So we're continually keeping an eye on the latest research and charities that are working on that area to make sure that the charities that we have in the fund are the right ones and there's not interventions where there's new evidence base, so we should be adding or removing things. So that's my role there. And I continue to work kind of with various different folk and some funders who have specific needs. I will jump on calls with them and help them with tailored giving plans, helping organizations like Founders Pledge and others who are thinking of having cause areas for violence against women and girls, and kind of helping with ad hoc campaigns. So for example, a few weeks ago, there was a Ugandan marathon runner, quite a famous and very good marathon runner, who was burnt alive by her husband. And so High Impact Athletes, which mobilizes athletes who are very good in their sport to give money to charity, wanted to do a campaign around this. And so I've been working with them and some of their athletes to, get them to be ambassadors and give to some of these charities and things like that. So these kind of ad hoc things kind of come about here and there. So really those are the main things that I wanted to talk about. I think that the takeaways are, it's a really important area. There are actually not that many charities working in it. So we only found 3 charities. The caveat is we were looking for cost-effective charities that could absorb at least $500,000 in funding a year, but there weren't that many charities there. So there's a gap here for more charities and more efforts here. There's also, all those charities still have room for more funding. So it's a very, very neglected area. And even though there is a bit of maybe a mental barrier in understanding some of these interventions and how effective they are, there are incredibly cost-effective interventions. And then on the meta level, I think, my main takeaways were, 1, you don't have to be a PhD expert working in an area for 20 years. When I was having conversations, I always felt like an imposter. I'm like, who am I to say what charities should be given to this area? But then I talked to my wife, she's like, well, no one else is doing this. No one else is trying to push these charities forward and put it on the philanthropic agenda. As long as you're not lying and pretending you know everything about this area, what's the counterfactual? The counterfactual is no one does this, right? So you don't have to be an expert. As long as you're clear about your expertise, you should feel confident to try and do something and make something happen. Talk about your work and share your working. So I shared my work on the forum. I talked to people about it. And because of that, opportunities arose that I never would have thought possible. But sharing your work and talking to other people about it is really, really beneficial. I think, and also always be collaborative. So at all different points, if I kept this work to myself, it wouldn't have gotten anywhere. So I always tried to speak with experts, speak with other organizations. I've always been willing to give my time to people. Like, I could have gone to Founders Pledge, who are looking into violence against women and girls, but you can just read my reports and then let me know if you have questions. But I jump on calls with them and help answer their questions. They have research uncertainties. I will go and research it for them on their behalf, or connect them with experts. If you're interested and passionate about an area, offering value for free always comes back to help you. And so where you can, be a helpful team player to the ecosystem. I think that's one thing that I think is really good in EAs, that people tend to be quite selfless and help other people around them doing work. But I think that there's a lot of value to doing that, and I've learned that kind of firsthand through this as well. But I'll stop there. That's all I really wanted to say.
And maybe I can quickly jump in and say thank you. I think it has been so inspiring, especially that you've been so proactively just thinking about this, researching this, going out, sharing your work, and all that has come from this. I think you had like a huge counterfactually positive impact there, and it's very inspiring. Thank you so much for sharing this with our community. And maybe we can open it for questions. And please feel free to also just unmute yourself and speak. Feel free, Alex.
Can you hear me?
Yeah, we can hear you, yeah.
Yeah, thanks so much for this. I'm curious, like, for researchers in this area, like, if you have a sense of what are the kind of highest potential, like, unanswered questions that you would hope people would conduct high quality studies on in like the next few years?
Yeah, it's a really good question. So there's a lot of people who are interested in mass media interventions to prevent violence against women and girls. And I think when you think of mass media, like, what is a 30-second ad going to do to change attitudes? But the model of these, the edutainment is like radio or TV shows. So we've shown that that they can improve knowledge to and access to contraception, and it's incredibly cost effective. And there's a hypothesis that mass media edutainment for violence against women and girls could be really effective. So I think there are 1 or 2 RCTs underway for this, but when I did a cost effectiveness modeling, it looks like it could be crazy cost effective, but there's not enough data there yet. And so I think that could be an incredibly cool and effective solution, but we need high quality studies. The reason I didn't recommend, and there are 2 or 3 charities working on it, was that we didn't have enough data. Actually, I wrote a report for charity entrepreneurship now called Ambitious Impact, and there's a charity that started doing mass media campaigns on this area, but the evidence base, I think, there could benefit from a lot. Secondly, and quite surprisingly, there's not that much work on like what policy work we should be doing in this space. So there's some ideas on like what impact does policy work on increasing women's access to land ownership, policies are like that protect women early, like trying to ban early marriage, making access to divorce easier, these kind of policy changes. There's always been a lot of talk about that these might be quite effective and cost effective, but on the policy angle, there's no real consensus on are these effective, which are tractable, and a prioritization of different policy interventions. I think if we had better data on this, then we would see more organizations doing this, and then potentially we would know what to fund there. A third area that I would love to see, because I think it would bolster the case for more philanthropic investment, unfortunately, is that we need higher quality data on the economic effects of violence on women, on their economic livelihood. Unfortunately, in a lot of countries, money talks. So I work in other areas of infectious diseases, and governments might not necessarily care about the health costs, but if you can show an economic cost from hospitalizations or time off work, they'll respond to that. So if we can demonstrate the economic harm of violence in a stronger way, I think that's a third area that I think would maybe shift the needle for some of these countries to invest more money. So these are 3 areas that I would love to see more work on. Even I don't think there's a systematic review of edutainment mass media campaigns for violence against women and girls. That's a sitting duck for someone to write a systematic review on, or a narrative.
There's one in progress. It'll be published soon.
There you go. I'm sure. Yeah, you know what I mean. So like, it's a very underexplored area. But those are the 3 things I would prioritize. Firstly, yeah.
Could I ask a follow-up question about?
Yes, please, of course.
So there is one that you read, Amber Peterman's systematic review of violence against women, and she has a lot of really great work on
It just came out in SSRN recently, right? Yeah.
And I guess like a more specific question about edutainment, because that's the kind of work that I do on, and I've been working with Nova, with Alexis and Ivy, and I'm curious. So like, yeah, very broadly, we just need more kind of RCTs on this, or need more quasi experiments on this. But like these cost like millions of dollars. Like each one costs millions of dollars to run a high quality study. And the way you get funded for those studies, as you know, is like you need to propose some like novel theory of change usually.
Yeah.
And then like USAID or SBRI gives you enough money to be able to fund it. So I'm curious, like what theories of change, or like maybe in edutainment specifically, or maybe like what are the 2 theories of change or that you feel like are most promising, but we don't really know if there's a difference, or like what are some promising but yet untested? So like you can talk about changing attitudes, or trying to change norms, or targeting men, targeting women, targeting both. Like there's so many different variables, like the length of the whether it's radio or whether it's TV. Have you had a sense, like, given that you've reviewed this literature so much, like what are the things that are high potential, but maybe like that combination of active ingredients within if an intervention hasn't been
Yes.
evaluated yet.
So I'm not sure if this will entirely answer your question, but some of the things that have looked potentially promising are violence often happens in the context of men being drunk. And so one potentially promising avenue for this is edutainment campaigns that are, like, part of it is don't go home and hit your partner if you have had something to drink at the bar or the pub. And so, like, the theory of change here is you educate men on how they might be more emotionally volatile and more likely to be violent when they are drunk. They are less likely to go home and hit their partner when they're drunk. So this is one potentially promising avenue. Some of the ones are empowering women to accept that violence is not okay in the home. So the theory of change there is edutainment campaigns that empower women to not accept violence in the home, and then either they're able to assert themselves to their partners, and their partner is therefore no longer violent, or it persists but they feel empowered to seek other kind of legal or other supports. These are the two kind of that's not really theory of change, it's more two of the potential programming approaches that I've seen. But I think it's always going to be a combination of edutainment campaigns targeted for men to show them that violence is not okay, or in situations where violence, there might be high risk, like when they are drunk, or in high income countries when their team has lost a sporting match, that they shouldn't be violent, and to empower women to not accept violence. So these are like the two mechanisms through which I've most commonly seen those edutainment campaigns could work. But whether or not they are sufficiently able to shift those attitudes or not is a separate question. Yeah. There's a question from Ulrike about cost effectiveness. I'll go to that one, and then Himanshu, maybe to you after that. You talked about the good, I'll read the question out just because it's recording. You talked about the good cost effectiveness. As you said, it's work on a community level. I think you need some time to train the workers, and the workers need to be in the community 24 to 48 hours, if I understand correctly. You do. I understand that it's still more cost effective than, for example, the self-defense course, but compared to, for example, the field of infectious diseases, the cost for tackling the problem are quite high. No. Yeah, great question. So actually the people working on the community level are volunteers who already live in that community, and they get technical assistance. So one of the organizations, for example, Sedivit, works in Uganda, in a couple states, Kampala and northern Uganda. So they provide assistance. The charity provides assistance to local community volunteers who are the ones day to day doing this kind of slow but worthy work of culture and gender norm. So the cost that is incurred is actually just the cost for an organization like Sedivit to train and support those people working on the ground, but they are not. The people working on the ground are not being paid. There is obviously some cost in training and supporting those people, but because it's people in the community, they're going to be staying there, and because they're volunteering, there is no cost associated with their time. And so we looked at the actual cost of delivering this intervention is actually very, very low, because if you're an organization like Sedivit, you can provide assistance to multiple different communities at the same time. And because there's a playbook of how to do this community-based activism, it's not like they have to reinvent the wheel every time in supporting those communities. So that's, I think, part of the reason that it's able to operate so cost effectively. Hope that answers your question. And please put in the chat if there's any follow-up to it, but I'll go to Himanshu next.
Yeah, so while we were talking about use of technology in order to solve this problem, there has been some work by a research lab at Cornell which talks about how technology actually enables the abuser rather than empowering the victim. And so it's like there are it's mostly about intimate partner violence. Even after the women they try to move away from their violent partners, they are stalked by them online, and they are like doxed by them. So they're in multiple ways they are harassed and they are put under dangerous situations because of using tech. And sometimes the solutions to these things are like not that difficult. They can be complicated at times and require like tech-based initiatives only. But sometimes they are simple in the sense that you just need to educate women about how to like protect themselves using this technology while we are training women for like for we are physically training them how to avoid how to protect themselves from this kind of violence. I think digital training could also help. And my question to you would be, what how much have you seen what uh, what have you seen the role of technology has been in like enabling these like the perpetrators of violence and
Yeah, it's a good question. So like obviously I have a couple thoughts on here. It's quite a complex area, to be fair. So technology, in some senses, can be used as a frontier for control of women as well. It's another means through which to perpetrate violence. Kind of cyberbullying, cyber violence. So it can be used as a means of perpetrating violence. Also, it's intervention in this area are really tricky. So taking a step back, there was a body of work looking at giving unconditional cash transfers to women, and one of the outcomes that they looked at was, okay, the hypothesis was if we give unconditional cash transfers to women or microloans to women, they'll be more empowered, they will accept violence less, and therefore there will be less violence. And some studies found that was true, but some studies found the inverse, or they found no effect. And part of the hypothesis was that when women were starting to get more power and money, their partners, and to be fair, 90% of violence against women and girls is intimate partner violence. I should have said that at the outset. Their partners would become the same, if not more violent. And so women being more empowered with technology, I'd imagine analogous to them having more money, could also cause their partners to become equally or more violent. So it's a tricky area. But I think technology can play a role. So we know that I think it can play a role in accelerating culture and gender norms. So, for example, an intervention like this community-based activism, it's working embedded within a community, but there's only so many people you can reach. And part of the appeal of edutainment is that through that, you could potentially affect culture and gender norms at a really large scale, right? You're able to reach so many more people so much more inexpensively with an edutainment radio campaign than you would be able to on the ground working in a community. So technology is going to be complex. Because of the way the global funding, so a lot of funding for violence against women and girls is foreign aid from high income countries to low income countries, which I don't love. I would love it if there was more funding from philanthropists in low middle income countries and also government funding from low middle income countries. I think that will come, but it's not there yet. But to kind of get more onto my point, so like folk like USAID are funding digital solutions for violence against women and girls and have a pot of money for that. I'm not quite sure whether or not like that's the highest priority thing to do. If I had money, I would just be funding these charities. I don't think right yet we need to reinvent the wheel, but there are buckets of money for tech and digital solutions to any problem, even if that problem doesn't necessarily need to be solved by tech and digital things. So, for example, one of the charities in our fund, Breakthrough, that does incredible work in India, in many states throughout India, recently got a grant by USAID for digital and tech work on violence against women and girls. And, they're grateful to do that work and to expand it into a potential new frontier. But I also think that if they just got an unconditional check for $5 million for their core work, they probably would have been a bit happier. But this is the world we live in. Yeah.
Thank you so
Just to follow up a bit on just 1 second. So just to follow up a bit on that, I think I agree with you that tech has mostly played a rather negative role, and from the research that I see from this lab, it seems that's the case. The kind of interventions that they are also suggesting are not really tech based. They are rather like how to control tech in order to prevent the violence that tech enables.
Yeah, interesting.
I just wanted to say, because we need to close off, after 1 hour in this call, we can have maybe one or two more questions. Maybe also now addressing people who have not asked questions so far, if you have any remaining questions or also remarks that you want to share.
If not, can also just say, kind of to wrap us up, is that I mentioned before that there's always kind of these little ad hoc opportunities that arise. So say, for example, right now, we're working with high impact athletes to try and think about how we can mobilize some attention and funding for athletes, given this marathon runner who has been burned alive by her partner. So there's kind of these opportunities that arise for more work. With the Life You Can Save, we're always looking to make sure that we're not missing any charities or interventions. So if anyone is interested in being involved in this kind of work and research, pop me a line. I can't guarantee there will always be work, but there will be opportunities that arise where extra pair of hands who are interested and passionate about this area would be really helpful. I don't have any money for this work. I did this just on top of my work. But I can't offer that. But if you were doing a lot, I'm sure, and we were doing a specific project with someone then, and that was a limiting factor, I'm aware that other people may not have that liberty that I do to do it outside of my working hours, because I have a stable income in the UK. So, if that would be a barrier and you feel like you want to do something but you wouldn't be able to volunteer, please still do reach out. I will if you're passionate about it and it's something you care about, we will figure that aspect of it out as well. So just wanted to extend that offer to everyone here, and anyone who might listen, just pop me an email.
Okay, thank you so much. Are there any, other maybe last minute questions or thoughts you want to share? Maybe also from the audience? Yes, please.
I'm just curious, Akhil, what the future looks like for you. Like, so you mentioned the work with high impact athletes. Is there other work in this space that you're looking to be involved in, or like, what does that look like for you?
Yeah, so I mean, for me, my role is going to be twofold. So continuing to manage the fund with the Life You Can Save, constantly updating it as we need to, adding, removing charities, keeping abreast of the research, and then I continue to advise other organizations on their giving in this area. So I think basically every 2 months, another EA or EA adjacent organization said that they are looking at violence against women and girls. So I provide kind of technical assistance to them to explore that. So Founders Pledge, Ultra Philanthropy, a couple of have reached out and asked for advice on the area. So I will kind of do that. So these are the two main areas that I work in. I would love, one thing that I was considering doing was starting like a specific fund for this. I think that with the Life You Can Save, the benefit of that is lower, but basically those two things with my current capacity is probably about as much as I can do. If other people have more time and capacity and want to drive forward work here, I would love to help and champion you. Like Nova, the new CE charity focused on mass media for violence against women and girls, I'm so glad it started, and I'm very pleased to serve as an advisor for them. So in conjunction to my offer, if anyone who wants to do research in this area, if someone wants to drive forward work, do outreach to philanthropists or to anyone to try and get them to invest more money in this, I'm really happy to stand with you and support you.
Thank you so much. I think we need to close now. But thanks, for everyone who has been joining us and for your time and interest in this area. And I hope you all have a lovely day. And thank you, Akhil, especially for having this conversation with us and sharing your expertise.
Of course, and thank you all for coming and for listening and sharing your evenings. Appreciate it. See you around.
Yes, thank you. Bye-bye.